is Francisco Garay, who is better known as Paco. Paco is the director of the Office of Economic Development and International Affairs for the city of San Miguel de Allende. We had Paco on, maybe about a year ago as a guest speaker, certainly when times were considerably different than they are right now. Paco's department's main goal is to work as a team with NGOs to economize their resources and how to get NGOs into places where the help has been limited. And he joins our meeting this morning via Zoom to comment specifically on how the community is being impacted by what's going on right now, the COVID-19 pandemic. And obviously everybody's thoughts are with everybody that's impacted, not only the people that live in the community, but also the vendors, the people that have all these wonderful restaurants that we used to enjoy. Hopefully we will be able to enjoy them again. What about all the vendors and all these different shops as you go through Central right now? Seriously, it looks like something out of the Twilight Zone where Martians came down and took everybody away. Will it ever come back? There we go. Yep. So Paco, take it away.
Great. Well, good morning, everyone, and thank you again for having me and for inviting me to give this talk. I prepared a little presentation that I'll show throughout that I think will help kind of illustrate more and make it a little bit more interesting. Basically, what I'm going to do is cover a few points. One, I'm going to cover the current status of the COVID-19 outbreak in the city, in the state, and in the country. I'm going to walk through the different actions that have been taken by the municipality to try to address this and stem the contagion of COVID-19 and kind of how it's been structured, how we've been working through all of this. I'm going to talk about the economic impact, as Skip said, and then I'm going to talk about ways that the municipality's been helping and the ways that different NGOs have stepped up. As Gary has mentioned, Feed the Hungry, as Melody said, Corazones Unidos. There's a few others such as Amigos al Cien, and obviously certain other considerations such as the Red Cross. So I'm going to try to cover all that. I'm going to be as quick as possible. I'm going to start sharing my screen now. Can folks see that presentation?
Yes. You're good.
All right. So just the current situation that we have currently. Basically in Mexico, yes, as of yesterday, there were 15,529 confirmed cases. There are about 8,000 additional suspected cases and about 46,000 cases that have been tested and were found not to be COVID-19. All information basically on all the official statistics are derived from the Secretary of Health, and specifically for the state there, you can find them at that website at www.coronavirus.guanajuato.gov.mx. And that's where you can find all the updated information. They update this a couple of times a day. And obviously, as for those of you who've been listening to the different presentations that the Subsecretary of Health does on a nightly basis, they're doing a selective testing process, which is basically for people who have serious symptoms and then a percentage of people who are showing lesser symptoms. So on the confirmed cases, the estimate is you can multiply it by about 8 to 10 to get to the real impact that COVID is having in Mexico. At the state level, what we have currently is about 271 confirmed cases. And specifically in San Miguel, where we've been holding firm at about 7 confirmed cases. Currently, there's about 5 cases under investigation. San Miguel started with about 3 cases and then held steady for about 15 days at those same 3 cases until last weekend when it jumped by 4. You can see on this slide kind of how the growth of the epidemic has been here in the state. This is representing all 271 cases, and you can see on a daily basis how many new cases have been identified. So you see that there was a clear jump starting right after the middle of April in terms of the number of daily cases that are being reported. That has also led to kind of more to stricter restrictions at the state level and also within different municipalities after this jump kind of at the middle of the month. How we've been working, the measures taken by the administration. Well, first of all, beginning back in, yes.
Paco, David here. I'm sorry to interrupt, but I just want to be clear on the statistics. Based upon what you said, and based upon what the Secretary of Health said, the formula is if you use the 8 or 10 formula, then if there are 7 cases identified in San Miguel, you multiply that by 8 or 10, and that means that according to his statistics, there are at least 50 cases in San Miguel. Am I correct, Paco?
Well, I think it depends. I mean, you're taking that as a whole in Mexico. So does it necessarily mean that there's 50 cases specifically in San Miguel? I mean, I guess that would be the way that it would operate, whether it's going to be more or less, it could be more or less. You know, I think it depends. That's the general way that that testing process works. I think one of the things that, you know, that we're hopeful of is that we took action you know, right at the beginning. If you look at this slide that I have up right now, you know, as of the 15th of March which is when we announced the first measures, there were still no cases reported in the state. You know, we knew that the cases were going to appear, but there still had not been any confirmed cases. So we're hopeful that, you know, we were able to act quickly and act early and to try to avoid that. So that is generally the way you would multiply that out. Obviously, I'm not an epidemiologist, so I can't tell you specifically if that would be for all locations, but yes, you would generally multiply by 8 to 10 to get at least the national number.
Thank you.
All right, we're going to hold off on any further comments until the end.
Yes.
So just how we've been acting, how the municipality's been taking measures to prevent the spread of COVID-19. So as of beginning on Monday, March 16th, the mayor basically declared a permanent cabinet session. That week we had 3 very long sessions establishing the first actions that were going to be taken in order to prevent the spread of COVID-19. We've also been having weekly, bi-weekly meetings with the health sector. This includes health sector representatives that are from the health jurisdiction, from the crisis, from the general hospital, and also from the private sector. So we've been incorporating both the public health sector and the private health sector in order to really have a sense of what is happening in the city, what is happening at the public hospital, what's happening at the private hospitals, you know, what the Red Cross is reporting, et cetera. We also had private sector meetings. These have been a little bit more focused on the economic impact. So we've been meeting with the hotel representatives, restaurants, bars, spas, Canaco, which is basically the small business association, tour operators, event planners. Separate from this, we've also been speaking with the industrial park representatives, et cetera. So really trying to work with all the different economic segments of the city to align, to make sure everyone's aligned on the same strategy. How the measures were taken, the first measures, as I mentioned, were actually announced on March 14th to be implemented on March 15th. This included the cancellation of classes in line with the state, and which occurred a week prior to what the federal cancellation date was. We also canceled all public events organized by the city of any kind. We closed certain city spaces that are open to the public, such as the Comuden, the Sedecom, the cultural centers, and the library operated by the city. So that's separate from the public library. I think at this point, the public library might have also had just announced that it was closing its doors. On March 16th, we took additional measures applicable primarily to city workers, where some of the things included were paid time off for workers above a certain age and who had certain pre-existing conditions. Also just encouraging working from home and trying to space out the number of people who congregate at the different offices of the city. On March 19th, to be implemented on March 20th, we announced stricter measures in coordination with a lot of the economic sectors that I previously mentioned. This included closing bars, gyms, theaters, restrictions on restaurants, and not only on the amount of people, but also on their operating hours. Public markets, where we limited basically the sale to food staples, basically limiting clothes and shoes, etc. And then we also took stricter measures for public transportation, convenience stores, and banks. Since then, we've been taking additional measures on a rolling basis and an as needed basis. This we've been doing in consultation at all times with the health sector, our civil protection department, different members of the administration, and also we've been, it's been very helpful, but we've also been receiving information from the community at large of things that we should consider. Sometimes, we're not everywhere all the time, so we get reports of a lot of different things that then civil protection looks into. Some of these rolling basis measures that have been taken is basically the implementation of the sanitization brigade, which is about 70 people attending different main areas of agglomeration, including plazas, markets, bus stops, the main bus terminal, and really they've just trying to attend to where people congregate. A lot of people ask, well, are you going to come out to this colonia or this community? Well, the idea more than, attending all of San Miguel is really to attend where people congregate, especially where people coming from different places of San Miguel are congregating. So what we want to avoid is if there is an outbreak, we want to make sure that we avoid that outbreak spreading to maybe being taken back to a community, being taken back to a colonia. And so that's why the sanitization brigade is focusing on these central areas of congregation. About a week ago, we closed down a couple of banks, basically for not enforcing the additional safety measures. It was back and forth. It wasn't done on a, no notice basis. Civil protection had gone to these banks at least 10 times, had always tried to reach agreements with them on how it was going to be managed. At the lack of kind of that management of the people congregating outside by the banks, stricter measures were taken. And this was especially in light of kind of the jump in cases that we saw. We saw a need also for taking stricter measures in these places of congregation. Also, we've seen some of this in the supermarkets. I think all 3 of the major supermarkets are now operating on strict guidelines. Aurrera, for instance, was also at one point visited by civil protection, and they basically sat down, went over what the different guidelines were going to be, limiting the number of people entering the store, etc. And we understand that it's difficult because sometimes, and I'll get into this on the next one, but sometimes people just don't want to obey the measures, even if the employees of the store, employees of the bank are talking to them. So, civil protection and the different security forces have been working with the different banks and supermarkets primarily to ensure that all these measures are being adhered to by the people visiting them. Also, closure of common areas in residential areas. One of the things that we didn't want was to have people just coming and saying, oh, we're going to quarantine in San Miguel and gathering around in these common areas and basically congregating in these common areas. So some of the biggest areas of non-compliance are private social events, and there's been reports of it here, but I saw yesterday a news article in Querétaro as well, basically where these private events are basically the biggest issue for enforcement. So you're still seeing quinceañera parties, you're still seeing family reunions, you're seeing birthday parties. This weekend we had reports of 2 horse races in different communities, that were congregating about 100 and some people at these places. Obviously no social distancing, no health steps of any kind, right? And we're still getting gathering in public parks and recreational areas. The ones that we were able to close down, we've tried to close down, but a lot of the ones in the communities and the colonias are open spaces that really can't be shut down. And so we're still getting a lot of reports. So civil protection is basically operating 24/7, attending to all of these different reports. And it's an issue here. I think it's an issue in a lot of the different states in Mexico. And for what I see in the news, it's an issue other places such as the States as well. That people going to beaches, etc. So I think this is generalized, but San Miguel's no different, and civil protection is working actively to try to minimize these kinds of private events. That's generally the steps at a very high level that have been taken in terms of trying to prevent the continued spread of COVID. I'm going to do a couple slides now that I presented the first time, just so that those of you that are joining us that didn't listen or that weren't there for my first talk can kind of get a sense of what San Miguel is. So the average age of the population is about 22 years old. That's very young. On average, not only for the state, but for the country, the average age of the state is about 26. So we have a very active population, a very active economic population as well. Our population is somewhere here, it says 171,000, but really it's about 180,000 at this point, 182,000. We have people from 64 different nationalities. Our estimate's approximately 14,000 people from in the expat community of all kinds of these different nationalities. The women-men ratio is about 55-45 women to men. And then we have the big number here is the communities. So we have about 528 communities all around the municipality of San Miguel, and about 90,000 of the total population is in the city center or in the urban area. The rest of that is out in these communities. So you're looking at about 60-40 urban center to the communities. We have about 56,000 in the economically active population. This was from the last economic census. We're waiting for the new results from this new economic census, but we think this is going to jump to probably about 65,000 people. Prior to this, we had an official unemployment rate of 5.69%. That will obviously be changing significantly with the impact of COVID. And we have about 5,480 economic units. Economic units are basically the established businesses with your proper registry with the RFC. So obviously 5,480 registered. There's probably at least another 40% that are unregistered. And then I think the point I always love talking about is the NGOs. So we have about 120 nonprofit associations in San Miguel, the most per capita in all of Mexico. I think, that's one of the big blessings of San Miguel, is to have this big community of nonprofits that are always helping the community. And obviously they go from everything from cultural nonprofits to health and education nonprofits. So we cover the board there. The economic data, we had a gross domestic product of approximately $650 million. This is a 2015 figure. A couple of things to point out and why this is interesting is service and commerce. That's really where, as you can see, approximately 80% of our economy comes from. About 60% of that, or a little bit less than that, is either directly or indirectly tied to tourism. And this is really where we're getting hit with the COVID-19 outbreak. Manufacturing, you have at 6.5%. That's probably a little bit higher now as the industry has been growing in recent years. And then the other thing that I like to point out is the agricultural. So really agro industry represents about 11% of the economy of San Miguel. So it really represents a big percentage of it, and not a lot of people sometimes realize how important it is. This is not only the agricultural, this is also, we are one of the most important milk producing areas in the center of the country, in the Bajío region. So the number of industries with 50 more employees in 2015, we only had 5. In 2019, we have 32. So there was a significant growth. This is mostly due to the industrial park out on the highway towards Querétaro, but there's only 16 industries in that park. So you can see that we have about 16 other industries that are outside of that. There's been an investment in industry since about 2015 of about $1.3 billion, so a significant investment, and also a big job creation. So you can see that about 10% of San Miguel is now employed in the industrial park. Just in 2019, we had about 600 more jobs that were added to the industrial segment. The impact of COVID-19 on the economy. So the impact has been quite significant. As you can see, and as you can imagine, as I was mentioning, you know, the tourism segment, which represents approximately 60% of our economy, has been the most hard hit. And as you can see, out of the restaurants that were part of the different restaurant associations, 116 of 168 have closed. Those open are mostly for takeout. A few still. Sorry. Those closed. Those open, most are only for takeout, but a few of those still have table service, although not many. Hotel closures, the figures are about approximately the same. I think we're talking about 3/4 or 2/3 of the hotels and restaurants are closed. Of the hotels that are open, you know, most of those are only really for administrative functions, maintenance, security, etc. But a lot of hotels have permanently closed, really don't have any employees working there anymore. So a number of estimated jobs impacted for the restaurants. The estimate is somewhere in the 4,500 to 5,000 range. In the hotels, it's a little bit lower. It's about 3,000. You know, some of the workers at these hotels, kind of dependent on the size of the hotel they were working at. You know, we know that some of the bigger international chains are paying their employees for at least a month, if not 2 months, maybe 3 months, depending on the hotel chain. We know some of the smaller ones have made the effort to pay employees at least a month, but we know that a lot have been paid only maybe 15 days, and some were not given any severance at all. Obviously, that has certain legal repercussions, but at this point, you know, legal cases are going to be quite significant and really not any source of comfort for the employees who lost their jobs without any kind of liquidation. For those who received the 15 days, well, those 15 days ran out about 15 days ago. So, you know, right now they're starting that we're having that stress. And for the people who got paid for a month, well, that's coming up pretty soon as well. So, you know, that we're really starting to see the pinch on the economy of the impact of COVID-19. And the industrial park's no different. In the United States, automotive industry was considered in most states an essential business and remained open. In Mexico, it was not included in the declaration by the federal government as an essential business. So really, at this point, we only have 3 to 4 of the industrial plants still working. These are mostly to do with production of medical components or key transportation components for a number of different very specific carve-outs that the federal government did allow. One of the companies here produces plastic bottles for gel, for antibacterial gel in hospitals, etc. So they're much busier than they were before, but really they're the only one that's really been benefited from this. So we think that the approximate number of jobs impacted is about 5,000 people. The industrial park has been paying its employees still, so that obviously is a relief, not only for those employees, but also for the city, that these employees are still being taken care of. Some of them, unfortunately, have lost production supply chains or production lines to other countries. So because the US stayed open and Mexico closed down, certain of the automotive assembly plants will have to look for other suppliers. So for instance, one of the plants here lost 2 of its production lines to a plant in Romania. And that loss isn't gonna come back as soon as this is over. Once you lose those production lines, you've probably lost it for at least a year, if not more, and then he'll have to try to get it back. So right there, unfortunately, that does represent the loss of approximately 80 to 100 workers on those 2 production lines. And since that is not going to come back, those workers are going to be laid off. They're laid off with severance, but it does have an impact all the same. So I talked about kind of the big sectors, but really we're seeing an impact everywhere, right? You have artisans. Artisans really haven't sold any goods since the middle of March. Some artisans had shipments on the way to the US, and the stores that had ordered those shipments basically canceled the shipments. Some of them were still here, some of them were at the border already, but the stores in the States weren't open, so didn't really make sense to receive these shipments of goods. And they're basically stopping them at different places. Also, clothes and shoes sales and manufacturing, both of them have been impacted heavily, again, with stores here, but also stores around the country and in the United States closed. Doesn't really make much sense for manufacturing to continue. And here we obviously have the sales that are stopped. One of the areas that usually is somewhat insulated from impact on the tourism sector, at least, are the professional services. But unfortunately, because of the way COVID is acting, you have the professional services that are getting hit really hard as well. So you have dentists, architects, lawyers, and accountants, which are basically this middle class, upper middle class that has been getting hit really hard. So for instance, I was talking to a dentist regarding kind of if he's still operating at all. And he says, well, I'll operate for kind of emergency situations only. But in order to give just normal attention, I have to invest in 750 pesos per patient in additional protection equipment for myself and for the patient. So it really just doesn't make it cost affordable for the dentist or for the patient if you're going to tack on 750 pesos of additional fees for a dentist visit. So they've been getting hit really hard as well. Carpenters, welders, car mechanics, all of those service sectors have also been getting affected significantly. And then volume businesses, so gas stations, for instance, gas stations are reporting a 60% reduction in the consumption of gas. People are just driving less. But also, we also see the impact on businesses with US denominated inputs. So the milk producers in the area that I was talking about that are, represent a big part of the GDP of San Miguel, they basically have seen not their prices reduced, but the inputs that they get grain, they get medicine, they get machinery from the United States, and with the depreciation of the peso, basically it ends up being a 30% increase in their costs that they're obviously not recovering on the part of the cost of milk at this point. So, you know, we've seen widespread impact of COVID across all the different segments of the economy. So municipal efforts to help. There's been some state programs that were launched at the end of March, mostly in the form of small business loans. The governor announced 2 more programs just yesterday. I think those go into effect May 4th. And these are basically long-term loan programs. They're basically trying to encourage businesses to maintain their payrolls. Basically, they incentivize you to maintain your payrolls. You're taking out a loan to pay these payrolls. If you meet certain requirements, they end up being a 0 interest loan. You also have other loans that are focused on your operating costs of your business, so that you can basically keep the light on, you can continue doing maintenance, etc. At the federal level, there's been just basically the announcement of one loan program, 25,000 pesos for small, medium businesses. But at least in Guanajuato, there's been limited success in accessing these loans. So the municipality, basically you had the federal pocket of money is much bigger than anybody's. Then comes the state, and then the municipality, I guess, comes in third here in terms of the amount of resources that we have. But we worked together with all the different departments to basically pool together resources to be able to launch a support program, which is based on 3 pillars: the health, economy, and subsistence. For the municipality and for everyone who was basically consulting on the steps that should be taken for shoring up the municipality in light of this COVID contingency, health was number 1. So what we wanted to make sure was that we had enough health equipment for the public sector to be able to deal with any kind of COVID-19 outbreak. So a lot of investment is going into PPE, oxygen equipment, beds, etc. for the public sector. We were in close contact not only with the CAISES, but also with the general hospital to see what their needs and requirements were. We've also are preparing the use of alternative spaces in and around the general hospital. If things get bad, as they have in other places, we've already identified some alternate spaces in line with the direction of the general hospital. Those spaces have been allocated to different things. So if need be, there'd be an extension for attending COVID-19 patients. There'd be also a space for attending non-urgent matters that might come to the hospital to avoid any contagion of COVID-19. So there'd be an alternate space for that. And there's also the allocation of an alternate space for the medical personnel. So where medical personnel could rest, could get cleaned up, could have food, etc. So a space that would be basically set aside for them. We've also looked at extraordinary funding to the Red Cross. Basically this year they didn't do an annual collection, and they were also seeing increased costs because of the additional PPE equipment that they're having to purchase to attend to the different, to all the calls now, basically, right? You have to make sure you're doing more sanitization. You have to make sure that your paramedics are well protected. Basically, we want to make sure that not only the Red Cross, but all the public health workers are there to be able to attend to any COVID-19 cases. So we have to make sure that they don't get COVID-19. Then we've also been, we also allocated funds for attending people who have pre-existing conditions. So people who need chemotherapy, dialysis, etc. A lot of these people have lost their jobs, or the people who were supplying them with the medicine or the dialysis bags lost their jobs. So basically now we're have a an emergency fund to be able to try to help these people throughout the COVID-19 contingency. And then we've also been doing some of the stuff that's not so none of it's fun to talk about, but I guess some additional work on kind of preparing cemeteries for handling COVID-19 deaths, also working with the different funeral homes, making sure that they have the personal protection equipment to handle any influx of COVID-19 deaths. So that's been another part of kind of this effort that we've taken. That's basically on the health side. On the economy side, we launched a number of programs. One, we launched a temporary work program for up to 875 people, taking them through August 31st, basically focused on outdoor rehabilitation of spaces, cleaning up parks, cleaning up plazas, some more specialized infrastructure work, so roads, taking advantage of that there's not as much traffic to really fix in depth some of the roads that need attending to, etc. There's a small business program and a street vendor program. A small business program focused on people who have storefronts and have an RFC. Really, it's the number of segments that it's attending to is quite broad. It goes anything from the artisans to the mom and pop shops that sell clothes, etc. We left out of the program food stores. Actually, I think the only segment that might be getting benefited at this point or is staying basically the same are the little abarrotes stores in the colonias and comunidades. Since people are staying home more, these little stores are getting more visits as people go out and buy different food products. We also have a smaller program for street vendors who basically at this point have no sales. So that includes, the people who shoe shiners in the Jardín, selling the balloons, selling the nopales in front of certain areas, etc. And then we also have an agricultural program. We're doing a big investment in reactivating the agricultural fields. There's about 350 people who are being directly benefited by this program, helping them with seeds, fertilizers, and trying to get those fields reactivated. The impact of this won't be today, but we're looking at the COVID-19 effort as a long-term effort. It's not something that's going to just, the switch is going to get flipped off and everything will go back to being normal. No, so this is something that we're looking at for the next 3 or 4 months. Basically, they can start planting now, and after the rainy season or during the rainy season, then they'll start having the benefit of what they plant. Some of that will be for self-consumption, for the consumption of the community, and some smaller amount will be for sale to maybe the surrounding communities, and that's kind of how we focused it. And then we're also doing NGO. We have a specific amount that's going to go to funding different NGOs that are helping during the contingency or that were impacted by it. So I'll talk about some of the specific ones later, but we have Feed the Hungry, Corazones Unidos, but also some of the orphanages, so Mexiquito, Santa Julia, Corazones Valiente, and also Alma, who have been impacted because of the reduction in the number of donations that they are receiving, both monetary and in kind. A lot of them receive donations from the different hotels or restaurants of kind of the excess foods that they would have, and those donations have disappeared. So the idea here is to kind of help them cover that shortfall to secure, at least on the food and nutrition aspect. And then we have a subsistence program. The municipality is launching a subsistence program. It's working at specifically, basically we have their areas that are mapped out in the censuses of very vulnerable areas in the city. And our program, rather than being an open program, is working within these areas, going house to house and doing basically a census of the impact that COVID-19 has had and where they stand in terms of specifically income and food distribution. So what we would be doing is food distribution based on this very specific mapped areas. And we're also collaborating with the agro industry. As I said, the agro industry, the surprise of the size here, but also the benefit of that is right now a lot of them are harvesting. So in collaboration with them, we're looking to deliver at least 6,500 fresh food packages over the next couple of months. The NGO efforts, well, the DEEF, although not an NGO, is kind of one of the ones that's leading this effort, and they're focusing on their target populations, which is vulnerable senior citizens and people with disabilities. Then we have Corazones Unidos, which is a partnership amongst a number of different NGOs, spearheaded by the Food Bank of San Miguel and Patronato Pro Niños, and we have Nori on the call. So she's been instrumental in this, but basically it's a collaboration of a number of the different NGOs whose day-to-day work had been impacted, who came together to form this coalition to continue providing assistance during the contingency. So for instance, Patronato, because of the health risk, had to stop basically visiting those communities to give dental and health support, even though they're continuing to support their kind of long-term children with kind of these long-term diseases. So, but they had to basically change the way they were operating. The food bank also had to change. They relied heavily on donations from restaurants and hotels as well, and basically are doing now they're doing fundraising, which they're using then to convert that fundraising into purchases of rice, beans, basically these food staples that go into these food packages. But they're also working on in-kind donations. So they've gotten a number of very successful donations from the agro industry, not only here in San Miguel, but also in the region, so Celaya and Irapuato. And some of the food they're distributing directly, some of their food they're distributing through other associations and other groups, and then through other institutions such as the DEEF. You have kind of one that came up very quickly during the contingency, which is Amigos al Cien. They're working to provide 500 to 700 families with food throughout the contingency. They organized very quickly to start doing this work, and they've been collaborating with Corazones Unidos and DEEF. Basically, what we're trying to ensure is a collaboration, sharing of information, make sure that no one that needs it is not being attended, and that areas are not being duplicated. And so that's really, there's a lot of sharing of information, a lot of sharing of resources that's going on to make sure that the impact is as efficient and as effective as possible. And then here we also have Feed the Hungry. So Feed the Hungry, basically what it did, since the schools closed down, it shifted its project to continue attending to the 4,000 children that it usually attends to throughout its 36 community food kitchens. But basically now it's providing food packages for the families on a bi-weekly basis. But as was mentioned, this implies a significant increase in cost. Previously, they were operating about 66,000 pesos a week. Now it goes up to about 500,000 pesos a week for the work that they're doing. The examples of collaboration, just so that you can see kind of what I'm talking about. As was mentioned, Feed the Hungry needed more people to assist. Also, a lot of its volunteers, due to the contingency, couldn't come out and work at the distribution center. Also, the work changed significantly, so now it's a daily necessity to put together these food packages. They're putting together about 400 different food packages a day. So the municipality has actually dedicated 9 workers that used to be with, or that are with, the Department of Culture, since the Department of Culture isn't having many events at the moment. Basically, those workers are free to assist and are basically at Feed the Hungry on a permanent basis. The municipality is also providing 2 trucks. One is a 3.5-ton truck, and one's a smaller truck, I think maybe 2 tons. and 2 drivers to help with the daily distribution, also incurring the cost of the gas to go and do those distributions. Corazones Unidos, as I mentioned, has obtained several tons of fresh vegetables. Most recently, it was obtaining several tons of fresh tomatoes on a daily basis. One of the agro plants was basically picking the tomatoes, but it had a lot of excess, as a lot of the different orders that it had been canceled. So to ensure that that didn't go to waste, they were donating it to Corazones Unidos. But when you get 2, 3, sometimes 4 tons of tomatoes all at once, in this weather, you have to act quickly. So basically what Corazones Unidos did was work with all the different institutions. It gave some, like it would give some tomatoes to the hospitals. It would give tomatoes to the different orphanages, to Alma. That distribution was being done by the municipality. And then it was also giving 500 kilograms to 1.5 tons of tomatoes to Amigos al Cien and to Desarrollo Social and the DIF for distribution as well. So really, basically, everyone's working together to make sure that the impact is as broad as possible, minimizing waste and minimizing duplication of efforts. Another one who's stepping in here is Vamos Mexico. They, one of their programs is a nutritional powder that is especially good for children out in communities. And so basically they're making a donation of 500 kilograms. With this donation, we're gonna allocate to the DIF and Amigos al Cien and a few other institutions to distribute that powder. So basically the idea is for everyone to be working together to broaden the impact. The other thing that I didn't put here, but I'd be remiss not to mention, is that there's a lot of community efforts, a lot of individualized community efforts. Colonia Guadalupe has a great effort where basically the WhatsApp group that they had basically on information for the Colonia came together, created a food bank, and now they are basically taking care of the Colonia. So people who are in need in the Colonia go to them and are attended to, and basically that removes you from the lists of the different other associations, so the DIF, Desarrollo Social, etc. So basically the collaboration and sharing of information is very essential. But I know, just like Colonia Guadalupe, I know there's efforts also in San Rafael, Independencia, and a number of the different colonias happening simultaneously and being done kind of by the private citizens coming together and organizing. If any of you are involved in any of those efforts, I would encourage you to come either talk to me personally or to talk with any of the other NGOs who are involved in this process. They can explain a little bit how we're trying to keep track of the different people that are being attended to. And, so if someone were to identify someone with a health need, not only a nutritional need, then that person with the health need could then be also channeled to the DIF or to Desarrollo Social for one of these other programs that I said that the municipality has in place. One of the things that we're seeing a lot of is the dialysis bags. So if someone identifies someone with that need, then we can channel them through the appropriate mechanisms to get support for ongoing treatment. At the end, I just have a slide showing the different opportunities for donations. So we had Feed the Hungry, Corazones Unidos, Amigos al Cien, Cruz Roja are kind of a few of the big ones that are organizing to attend specifically to COVID-19. But then you also have, as I said, the orphanages, Alma, et cetera, a lot of these different institutions that basically are losing a lot of the donations that they used to get. So reaching out to any of those are also great options. So that's it. Thank you. I know I went over my time and I apologize for that, but I guess I'll now open it up.
Well, thank you, Paco.
Hey, Paco, thank you very much. You make me feel proud to be a resident of San Miguel. I'm very, very impressed. And I don't think most of us on here had any idea of the extent of the work that the municipality has been going through. So thank you.
Well, thank you, Gary. And I think it's really important to mention. I think not only the Mexican community, but the foreign community of San Miguel has really stepped up big. And we were discussing that the other day, is how much the foreign community has really come in to help and be involved in a lot of these different efforts. So I think this is something that's way beyond the scale that any single institution or any single government can deal with. And I think really what's going to be really important for this is just the community continuing to come together and helping to make sure that the impact of this is reduced as much as possible. Obviously the impact is going to be there, and it's going to be difficult to attend to all the different needs that are being developed, but the collaboration, I think, is key.
Well, Paco, you have to remember, this is our home.
Of course.
And so, yes, we're residents. So obviously we want to help like all residents do.
Gary, we have, do we have some time for some questions? Some people have sent some questions in if we've got time.
Okay, I want you to pick the questions that were not answered during the presentation, because there was a bunch I saw come up that were answered.
Gotcha. Paco, what does our timetable look like for a reopening of any kind?
So that question, I think, is very difficult to answer at this point. I think we're basically taking direction from the federal government and the state government in response to this. I didn't put it on there, but the mayor is also having weekly meetings with the governor. The governor's talking with all the municipalities at once, and also with certain municipalities, depending on kind of the specifics of the demographics of those municipalities. He's also grouping them. So kind of the bigger municipalities have different concerns than some of the smaller municipalities, et cetera. But basically, we're taking our cues both from the federal government and from the state government at this point. And from what I understand, they're still expecting the peak in contagion at the country level to come in the next couple of weeks. So I think at this point, it's still a little bit too early to start thinking about opening up. At this point, we're really still working on trying to ensure that those measures that were put in place are actually being adhered to, so that we can move to opening up as soon as possible. But as I mentioned, kind of when the city was thinking about putting together a strategy for dealing with COVID, we didn't think about a strategy for a month. We're not thinking about a strategy for 2 months. We know that even once we do start opening up, a restaurant that does manage to open up is not going to open up with the same number of employees as it had before. Hotels are going to open up more slowly, we think, because people are going to be motivated to travel kind of further down the line. One, because of the health contingency, but two, also because of the economic impact that everyone is feeling. I don't think the first thing that people are going to want to do is, go travel and spend money at a hotel. So we're trying to plan for this long-term reopening of San Miguel. We are also, planning out on the horizon to have events that would eventually draw people back to San Miguel. But really, at this point, I feel that putting any kind of time frame on it would just be a little bit too soon, and really, we really have to wait and see what the federal government and the state government start kind of implementing. We do think that we start seeing some action in certain sectors. So the industrial sector, we think, is going to start reopening up very soon. The agreement kind of with the United States is that when the United States starts reactivating certain key functions, even though they were basically functioning throughout, certain automotive companies did shut down temporarily due to supply chain issues, but we do think that they're reopening in a lot of places over the next week and a half. And so that we'd have to see some movement here in Mexico to reopen maybe a week after that. So I think by May 8th, in terms of the industry, you'd start seeing some reopening with a lot of health measures in place. But kind of the tourism and that sector, I think we'd still be a little bit premature to give you a good sense of when that will happen.
Another question here. Have you seen an increase in crime?
Have we seen an increase in crime? I don't have those statistics on me. From just my sense, and maybe there's a few other people on here who can probably comment on this better than I can, but from my sense is that we actually haven't seen a real increase in crime at this point. There is that concern, obviously, as economics get harder, but really, we don't think that a lot of people are going to, necessarily turn to crime as a result of this. Basically, what we want to make sure that we're doing is attending to those people and making sure, a lot of people that, as I said, that are being impacted by this is that middle class, the people who all their lives have been hard workers, who as a result aren't on any of the kind of benefit programs that exist. So those are the people that we want to make sure have a safety net that they can fall back on. They're used to working their entire lives and we're able to make do, but their savings will eventually run out, and so we want to make sure that we're there to step in.
Very good. Paco, thank you so much for being here today. Very, very valuable information. Thank you.
Thank you. And I know there's a lot of questions. I see them. Feel free to reach out and contact me. I did not put my contact information at the end of the presentation, but my email is pretty simple: francisco.garay.sma@gmail.com is my email, and you can reach out with any questions if you want to follow up. But again, as always, thank you very much for your time, and thank you for everyone who took the time to join me.
Thank you very, very much. This has been enlightening. Please, if you're on the membership committee, stay on the line, because Bart will be chairing that meeting immediately following this meeting. And this meeting is adjourned.
Thanks, everyone. Thank you, Paco.
Thank you. I'm going to just jot down some of these questions real quick.
Would that PowerPoint be available to us to share?
Yeah, I can. I'll PDF it and I'll get it over to the Rotary, and they can distribute.
Thank you.
Yeah, send it to Ron, and he can put it out.
Okay, great.
Or you can send it to me, Paco, and I'll get it to Ron.
Okay.
Whatever email you have in your file handy, just we'll get it to him.